Thank you for joining me today. We are going to talk about something very important for your health. It is called poor circulation in the legs. Many people ignore the early signs, but those signs can tell us a lot about what is happening inside the body. If we notice them early, we can get help and prevent more serious problems. So today, I will explain what poor circulation is. I will show you the warning signs, and I will help you understand what to do next. Let us start with the basics. Your body needs blood to carry oxygen and nutrients. The heart pumps blood through blood vessels called arteries and veins. Think of your blood vessels like water pipes in your home. When everything is working well, blood flows smoothly. It reaches every part of your body, including your legs and feet. But sometimes the flow of blood slows down or gets blocked. This is called poor circulation. Poor circulation means your legs and feet do not get enough blood. Without enough blood, your legs cannot get the oxygen and nutrients they need. This can lead to pain, skin changes, slow healing, and even serious infections. It is more common in older adults. That is because blood vessels can get narrow or stiff as we age. Certain health problems also increase the risk, like diabetes, high blood pressure, or smoking. Now let me explain it in a simpler way. Imagine a garden hose. When the hose is open and clean, water flows easily. But if something clogs the hose, water cannot get through. The same thing happens in your body. If your arteries are clogged with fat or plaque, blood cannot reach your legs properly. That is poor circulation, and your body will try to send you signals. But you need to know how to read them. In this video, I will go over the most common signs of poor circulation in the legs. Each sign is like a small warning light. If you notice one or more of these signs, do not ignore them. Now let us look at the first warning sign. One of the first signs of poor circulation is cold feet or cold legs. You may notice that your feet feel much colder than the rest of your body. Sometimes one foot is colder than the other. This can happen even when you are in a warm room. Why does this happen? When blood cannot flow well to your legs, it cannot keep them warm. Blood brings heat from your heart. If blood is not reaching your feet, they start to feel cold. Now let me give you an example. Have you ever touched a metal doorknob on a cold day? That sudden cold shock, that is what your foot might feel like. Some people say their feet feel cold all the time. Others say it comes and goes. Cold feet on a winter night can be normal. But if you notice cold feet regularly, even in warm weather, that is not normal. This could be a sign that your blood vessels are narrow or blocked. That means your legs are not getting the warm blood they need. Sometimes, you may also notice that your skin looks pale or blue. This also happens when blood is not reaching the area. What should you do if your feet are often cold? Try touching both feet with your hands. Compare the temperature. If one feels much colder than the other, that could be a red flag. Also, look at the color of your feet. If one foot looks more pale or blue, that could be another clue. If you notice this happening often, talk to your doctor. They can check the blood flow in your legs. They might use a simple test to see if your arteries are blocked. Remember, cold feet by themselves are not always a problem. But cold feet that happen often or in just one leg should not be ignored. It is your body's way of asking for help. Let us move on to the second sign. Another common sign of poor circulation is numbness or tingling in the legs or feet. This is when your legs feel like they are falling asleep, or you feel a pins and needles sensation. Some people describe it as a crawling feeling under the skin. It might feel like tiny ants walking on your leg. This numbness can come and go, or it can stay for a longer time. Why does this happen? When blood cannot reach the nerves in your legs, the nerves do not work properly. Blood gives oxygen to the nerves. Without oxygen, nerves send strange signals, or no signals at all. That is why you might feel numb, or feel tingling even when nothing is touching your skin. This can happen when sitting or standing still, or when walking. Let me give you an example. Imagine you sit on your leg for a long time. After a while, your leg goes numb. Then when you stand up, you feel tingling as the blood comes back. That is normal if it happens once in a while. But if you feel numbness or tingling often, especially in the same leg, it could be poor circulation. This is more serious than just a temporary problem. Poor blood flow can damage your nerves over time. If the nerves are damaged, you may not feel pain or injuries on your feet. You could step on something sharp and not even notice. This is dangerous, especially for people with diabetes. They may not feel cuts, blisters, or infections on their feet. That is why it is so important to check your feet every day. Look for cuts, bruises, swelling, or any strange feeling. If you feel numbness or tingling often, talk to your doctor. There are tests that check how well your nerves and blood vessels are working. The earlier you catch the problem, the easier it is to treat. Now let us look at the third warning sign. Another important warning sign of poor circulation is swelling in your legs, ankles, or feet. Swelling happens when fluid builds up in the tissues. Your legs may feel heavy or tight. Your shoes may feel too small. Your socks might leave deep marks on your skin. This kind of swelling is called edema. Poor blood flow can cause it. When blood does not move well through your veins, fluid starts to leak into the tissues. It settles in the lowest parts of your body, usually the ankles and feet. This swelling may be mild at first. It might only happen at the end of the day, but over time it can become more serious. Your skin might look shiny or stretched. Your legs may feel stiff or sore, and the swelling may not go away overnight. How can you check for swelling? Press your finger gently on your lower leg or ankle for 5 seconds, then take your finger away. If you see a dent that stays there for a few seconds, that means there is swelling. This is called pitting edema. Swelling can happen for many reasons, but if it is happening along with other signs like cold feet or numbness, poor circulation may be the cause. Let me give you a simple example. Think of a sink with a slow drain. Water builds up and stays in the sink. In your body, poor blood flow works the same way. Fluid builds up in your legs because it cannot drain back to the heart fast enough. If the swelling gets worse, it can lead to skin changes. Your skin might become dry, cracked, or develop sores. Sometimes swelling is caused by heart problems or kidney problems. So it is important to speak to a doctor. They can check your circulation and find out what is causing the swelling. Do not ignore it, especially if it is getting worse. Let us move on to the next warning sign. One of the most common signs of poor circulation is pain in your legs when you walk. This pain is called claudication. It usually starts when you walk for a few minutes. Then it goes away when you stop and rest. It might feel like cramping, aching, or heaviness in your calf, thigh, or buttock. Some people say it feels like a muscle is tightening up. Others feel burning or sharp pain. This happens because your leg muscles are not getting enough blood while you walk. When you walk, your muscles need more oxygen. But if your arteries are narrow or blocked, your blood cannot reach them fast enough. The muscles run out of oxygen and start to hurt. It is like trying to run while holding your breath. At first, you may only feel the pain after walking a long distance, but over time, the pain may start after just a few steps. In serious cases, you may feel pain even when you are sitting or lying down. This kind of leg pain is not the same as joint pain or arthritis. Joint pain often feels worse when you move the joint or press on it. Circulation pain feels deep inside the muscle, and it always improves with rest. Let me give you a simple example. Imagine you are driving a car uphill, but the gas line is partly blocked. The engine struggles and slows down. Your leg muscles do the same when blood flow is blocked. They struggle and send out pain signals. If you feel pain in your legs every time you walk, talk to your doctor. There is a test called an ABI, short for ankle brachial index. It compares the blood pressure in your arm and ankle to see if blood is reaching your legs properly. This test is simple and painless, and it can help your doctor understand how serious the circulation problem is. The earlier you find out, the better your chances of treatment. Do not wait until walking becomes difficult. Let us now move on to the next sign. Another clear warning sign of poor circulation is slow healing wounds on your legs or feet. When you get a cut, scrape, or blister, your body sends blood to help it heal. Blood carries oxygen, nutrients, and infection-fighting cells. But if you have poor circulation, that healing process slows down. A small cut can take weeks or even months to close. Sometimes it may not heal at all, and that open wound can become infected. Infections in the legs or feet are very serious, especially for older adults. They can spread quickly and lead to more severe problems. If you have diabetes, this is even more dangerous. Many people with diabetes already have nerve damage in their feet. They may not feel the injury when it happens. And if blood flow is poor, the body cannot repair the tissue properly. Let me give you a simple example. Think of a construction site. If the workers do not have enough tools or materials, the job takes longer. In your body, the tools are oxygen and healing cells. Without good blood flow, they cannot reach the wound fast enough. That is why healing is delayed. How can you tell if a wound is healing too slowly? Look at the skin around it. Is it still red or swollen after several days? Is it still open after 2 weeks? Is there pus, odor, or increasing pain? These are signs that the wound may be infected and needs attention. You may also notice the skin around the wound becoming dark or turning black. That is a sign that the tissue is dying due to lack of blood. This is a medical emergency. If you see any of these signs, do not wait. Go to your doctor or local clinic immediately. In some cases, poor circulation can lead to ulcers. These are deep, painful sores that often form on the feet, ankles, or lower legs. They can be very hard to treat if not caught early. If you have a wound that is not healing well, your doctor may check your circulation. They might look for blockages in the arteries or veins. They may suggest special bandages, medications, or treatments to improve blood flow. So always check your legs and feet. Look for small wounds, even if they do not hurt. If something looks strange or takes too long to heal, speak up. Your body is telling you something important. Now let us move on to the next warning sign. Poor circulation does not only affect how your legs feel, it can also change how they look. One of the signs you may notice is a change in the color or texture of your skin. You may see that the skin on your legs or feet looks pale, bluish, or reddish. Sometimes the skin becomes shiny or thin. You might also notice that the skin feels cool to the touch. In some cases, the skin turns a dark purple or even black. That is very serious and could mean tissue is dying. Why do these color changes happen? Because blood brings color and warmth to your skin. When there is not enough blood reaching the area, the skin becomes pale or blue. When blood gets trapped in the area and does not flow back properly, it may turn red or purple. Let me give you a simple example. Think of your hand when you tie a tight rubber band around your finger. After a while, the skin turns pale or blue because the blood cannot reach it. That is similar to what happens in your legs with poor circulation. Changes in skin texture are another warning sign. The skin may feel dry, cracked, or flaky. It may look shiny as if the top layer is stretched tight. You might also see that hair on your legs is no longer growing. This happens because the hair follicles are not getting enough blood to grow hair. You might also notice that your toenails grow more slowly. They may become thick or brittle. These changes do not happen overnight. They often build up over time. That is why it is so important to look at your legs and feet every day. If you notice unusual colors or your skin feels different, do not ignore it. These signs are often painless at first, so people think it is nothing to worry about. But they can be early signs of something serious. Doctors may check the temperature, color, and pulse in your feet. They may use a handheld device to listen to your blood flow. If they find something unusual, they may order more tests. The good news is, if you catch these signs early, there are treatments that can help improve your circulation, but you need to act before things get worse. Let us now talk about some even more serious signs that show up in later stages. If poor circulation is not treated early, it can become much more serious. There are several signs that show the condition is getting worse. These are called late-stage symptoms. One of these is leg cramps that happen at night. You may be lying in bed when your leg suddenly cramps up. The pain can wake you from sleep. It might feel like a sharp stabbing pain or a tight muscle that will not relax. This happens because your blood flow slows down even more when you're resting. Without enough oxygen, your muscles react with pain. Another serious sign is skin that turns blue, purple, or black. This means that very little or no blood is reaching that part of your body. When tissue does not get blood, it begins to die. This condition is called gangrene. It is extremely dangerous. If not treated quickly, the dead tissue may need to be removed with surgery. Sometimes people lose toes, feet, or even parts of their leg. Another warning sign is the appearance of ulcers. These are deep, open wounds on the skin. They are usually painful and hard to heal. Ulcers often appear around the ankles or on the bottom of the feet. They may look red, have pus, or have a bad smell. If an ulcer is left untreated, it can become infected. The infection can spread to the bone or the rest of the body. This can lead to a condition called sepsis, which is life-threatening. You may also notice your leg feels hard or tight, even when you are not moving it. Or your foot might swell up suddenly and become red or warm. That could be a sign of a blood clot. Blood clots can form when blood does not move well through the veins. If a blood clot travels to your lungs, it can be fatal. This is called a pulmonary embolism. It may cause sudden chest pain, shortness of breath, or even collapse. If you ever feel these symptoms, go to the hospital immediately. Let me remind you again, these serious problems often begin with small warning signs: cold feet, numbness, swelling, pain when walking, slow healing wounds, changes in skin color. Do not wait until the problem becomes dangerous. The sooner you act, the better your chances of avoiding serious damage. Now let us talk about who is most at risk of poor circulation. Poor circulation can happen to anyone, but some people are at much higher risk than others. Let us go over who needs to be extra careful. First, people with diabetes. Diabetes affects your blood sugar levels. Over time, high blood sugar can damage the blood vessels. It can also damage the nerves in your legs and feet. This makes it harder to feel pain, cuts, or sores. And with poor blood flow, those wounds do not heal properly. That is why people with diabetes must check their feet every day. Even small blisters or cuts can become serious if ignored. Next, people who smoke or used to smoke. Smoking is one of the worst things for your blood vessels. The chemicals in tobacco make your arteries narrow and stiff. This makes it harder for blood to move through your body. Smokers are much more likely to develop circulation problems in the legs. Quitting smoking can make a big difference. It is never too late to stop. Another group at risk is people with high blood pressure. When your blood pressure is too high, it pushes too hard on the walls of your arteries. Over time, this damages the lining of your blood vessels. Damaged arteries do not carry blood as well as healthy ones. That leads to poor circulation, especially in your legs and feet. People with high cholesterol are also at risk. Cholesterol is a fatty substance in your blood. When there is too much of it, it can build up on the inside of your arteries. That buildup is called plaque. Plaque makes the arteries narrow, like a pipe getting clogged with grease. Narrow arteries mean less blood can get through. That is a key cause of poor circulation. Now let us talk about people who are overweight. Carrying extra weight makes your heart work harder. It also increases your risk of diabetes, high blood pressure, and high cholesterol. All of these things hurt your circulation. Even losing a small amount of weight can help improve blood flow. Next, we have people who are not very active. If you sit or lie down for long periods every day, your blood flow slows down. Muscles help push blood back to the heart. If your muscles are not moving, blood can pool in your legs. This can lead to swelling, clots, and poor circulation. That is why walking, stretching, or doing gentle exercises is important, even if it is just for 10 minutes at a time. People with a family history of circulation problems are also at risk. If your parents or siblings had poor circulation or heart disease, you should be more careful. You cannot change your genes, but you can change your habits. Lastly, older adults are at higher risk. As we age, our blood vessels naturally become less flexible. That means it is easier for them to become narrow or blocked. So if you are over 60, pay attention to how your legs feel and look. You may not notice changes right away, but your body will give you signs. The key is knowing what to look for and what to. Now that we understand who is most at risk, let us talk about what you should do if you notice the warning signs. If you notice any signs of poor circulation in your legs, do not wait. The most important step is to talk to your doctor. They can check your blood flow and find out what is causing the problem. There are several tests your doctor may use. One common test is called the ankle brachial index, or ABI. This test compares the blood pressure in your ankle and your arm. If the pressure in your ankle is lower, it may mean your arteries are blocked. This test is simple and painless. Another test is an ultrasound of your leg arteries. It uses sound waves to show how blood is moving through your blood vessels. It can help the doctor see where the blockage is. Once your doctor knows what is going on, they can help you make a plan. This plan may include lifestyle changes, medications, or treatments to improve circulation. Let us go over some of these steps, one by one. First, get moving. Physical activity helps your muscles push blood through your body. Walking just 20 to 30 minutes a day can make a big difference. You do not have to go fast. A slow and steady walk is enough. If walking is painful, talk to your doctor. They may recommend supervised walking therapy. This is a safe way to build up your strength and improve blood flow. Second, eat a healthy diet. Cut back on foods that are high in salt, sugar, and bad fats. Instead, eat more vegetables, fruits, whole grains, and lean protein. Foods that are good for your heart are also good for your blood vessels. For example, salmon is rich in omega-3, which helps improve blood flow. If you eat 2 pieces of salmon a week, it can support your circulation. Third, quit smoking. If you smoke, stopping is the best thing you can do for your circulation. It is hard, but there is help available. Talk to your doctor about support groups, medications, or programs that can help you quit. Fourth, manage your health conditions. If you have diabetes, keep your blood sugar under control. If you have high blood pressure, take your medications and watch your salt intake. If your cholesterol is high, your doctor may give you medicine called statins to lower it. Fifth, take care of your feet. Check them every day for cuts, blisters, or sores. Wash them gently and dry them well. Keep your toenails trimmed. Wear socks that are not too tight. Choose shoes that fit well and protect your feet. If you see anything unusual, tell your doctor right away. Sixth, take your medications as prescribed. Some people need medicine to thin the blood or improve blood flow. These can help prevent clots or open up the arteries. Do not skip doses or stop taking medicine without talking to your doctor. In more serious cases, your doctor may recommend procedures to improve circulation. One option is angioplasty. This is when a small balloon is used to open up a blocked artery. Sometimes a tiny tube called a stent is placed inside to keep the artery open. In very serious cases, surgery may be needed to bypass a blocked artery. These treatments can help restore blood flow and prevent serious damage. The key is catching the problem early. If you wait too long, the damage may be permanent. Now let us move on to the conclusion of this video. Thank you for watching this video. Poor circulation in the legs is a serious problem, but the signs are easy to spot if you know what to look for. Let me remind you of the main warning signs: cold feet or legs, numbness or tingling, swelling in the ankles or feet, pain when walking that gets better with rest, wounds that heal slowly or not at all, changes in skin color or texture, night cramps or skin that turns dark. If you notice one or more of these signs, talk to your doctor. Do not wait. Early action can prevent serious problems later. Keep your body moving, eat healthy foods, take care of your feet, and follow your doctor's advice. Your legs carry you every day. They deserve care and attention. Stay safe, stay informed, and take good care of your health.